Good morning, everybody, and welcome back to yet another webinar being organized by Onco India. We have organized a webinar 2 years back, and the results of which the community, especially the women community in Bangalore, continue to refer those videos which are live on Facebook as well as on YouTube, and they still get in touch with us after 2 years. So the earlier webinar was on cancer prevention, especially cervical cancer prevention in women, and there was a lot of importance and information given out regarding the HPV vaccinations which are available. But today we have come out with yet another webinar, but this one is on advanced cancer care available in Bangalore. This is not a webinar which is specifically for promotional activities of Onco India or Trust in Hospital. We are in a community of Bangalore, and Bangalore has got a lot of advantages, especially when it comes to cancer care and especially when it comes to breast cancer care. So the advantages include one, the number of providers which are available who have varied technologies available. Of course, Dr. Shiva Kumar will be going into that in detail. The connectivity, because if you take India and if you take Bangalore and if you take the surrounding countries, the care available for a breast cancer patient is not that great when you take the rural belts or when you take the surrounding countries like Bangladesh, Sri Lanka. If you take countries from African region, the amount of care available is not that much. So whereas if you take the connectivity with Bangalore, if you take the connectivity, whether it is bus connectivity, road connectivity, or maybe even air traffic connectivity, it's very high. You won't believe it. Bangalore has got daily 2 flights to London straight, daily 4 flights to Dubai, and of course from Dubai you can get flights to almost anywhere in the world. So now these are all the topics that we're going to talk about. And the other side is that the technological advancements that has happened. When I was last speaking to Dr. Shiva Kumar, he told me about that a patient with 4th stage cancer has got treated and is continues with her life. So the extent of life we've been able to provide is great. So all these, the technological advancements, the latest advancements in cancer care, and what are the facilities that are available for an international patient who is coming to Bangalore, all this and more. And of course, we will also have a very interactive Q&A session also at the end of it. But before we start, I would like to take this opportunity to introduce Dr. Shiva Kumar. Dr. Shiva Kumar is a surgical oncologist and a gastrosurgeon or general surgeon, laparoscopic surgeon. But he has his interest in cancer because of his experience and exposure that he's got in treating various cancers while he was at the Kidwai Institute. And of course, for the last 10 years or so, he's been actively practicing surgical oncology, and along with a team of oncologists, chemotherapy, radiation oncologists, he has treated quite a few number of cancer patients. And he tells me that the number of incidences of breast cancer and cervical cancer are rapidly on the rise. So that is why this time we decided that we need to do this kind of a session where we don't talk about the kind of work that we do only at Onco India, but we also talk about a lot of other things that are important for a cancer patient who is looking to take treatment from Bangalore. Doctor, welcome to the event. Thank you for sparing your valuable time, and it's on to you. If you require the assistance from the PPT, definitely I will keep that available for you. But if you could switch on the camera, it will be simply great, sir. Thank you.
A very good morning to everyone. I'm Dr. Shiva Kumar Uppala. I'm surgical oncologist practicing in Bangalore. Today we are having this session mainly to highlight what is in Bangalore, or why do are we focusing on Bangalore? As Hemant already informed you all, so it is a center of medical tourism and hub as a whole. So many international patients we see, and as a connectivity part also we have a lot of direct flights, train and bus. And compared to in Karnataka, it's the capital of Karnataka, and we have a lot of connectivity from the other parts of the Karnataka. And as technologies whichever are coming over the world are being introduced in Bangalore in most early times, overall India I can say. So any treatment option, not only cancer, so we're seeing the latest advanced technologies, equipments, everything is being available in Bangalore. That's one thing, and we also see a lot of research happening, and a lot of we have a tumor boards are meeting and Bangalore oncology groups where we discuss all that cases or difficult cases, which so that a lot of minds are working together, providing the treatment cancer care in the Bangalore. Uh, so. Before going to the proper topic of breast cancer treatment, I would like to tell you, as a center in Trustin Hospital or Onco India, what we are doing, we are more centered in the treatment options towards a patient care and patient centric approach. We use individualized treatment options, say liquid biopsy of the patient, where you test the sensitivity of the chemotherapy drugs, or for example, genetic testing of the complete genomic testing, wherein we can tailor the treatment for each patient. And coming to breast cancer as such, so we're seeing a lot of more and more increased incidence of breast cancer, and the breast cancer incidence is a lot more compared in the urban population as it is compared to the rural areas. The reason being maybe our lifestyle is in urban, like not breastfeeding, delayed onset of marriage, not having much number of children. These are some of the risk factors. Along with that, alcohol consumption, smoking, and lifestyle. These are the things why we see more of breast cancer. Overall, India, most number of most common cancer is being cervical cancer, and the next comes is the breast cancer, which we see. And in especially in urban population, breast cancer is the one which is the highest unit. So, what are today we are discussing what is new in breast cancer treatment or diagnostics. Coming to the as you symptoms, common symptoms are like lump in the breast or a swelling or what you feel when while touching the breast or while taking bath. That's what most women come with the complaint. And some discharge from the nipple, or there's a change in the color of the breast, and there are some lymph node in the axilla. These are the common symptoms which they come across. And then coming to the diagnostic aspect, where standard or gold standard being is the true cut biopsy. To avoid what you say negative biopsies or false negative biopsies, what we do is a image guided biopsy or where ultrasound guided biopsy. That is one thing which is new. And sometimes what most of the patients with breast cancer undergo chemotherapy before surgery. So at the time of biopsy, very small lesions, what we do, place a marker or a clip in the tumor, so that after the treatment of chemotherapy, the tumor is disappeared also, we will be able to identify where was the lesion and give a clearance of that area during the surgery. And other than that, coming to the staging workup, when we see whether the tumor is related to the breast, it is a stage 1, stage 2, or stage 3, or stage 4. What we do is generally PET scan. In recent advances, we have something called is receptor guided PET scan or FDG PET CT, wherein it will be able to identify whether the estrogen receptors positive tumors are there in the metastatic setting. So PET scan will tell us whether the tumor is spread or not, advanced stage, or it is near to the axilla and all. And after that, coming to the treatment part. In treatment, most of the early breast cancers, initially before maybe a decade before, the treatment option was radical surgery, wherein we used to remove complete breast, lymph nodes, axilla, and it was a quite mutilating surgery, and patients had to go a lot of complications post surgery. And nowadays, with advent of neoadjuvant chemotherapies, targeted therapies, we are going towards a trend wherein we are conserving the breast, which is cosmetically and with a safety of cancer-free to lifestyle mode. So what I mean to say is, we're going from a radical approach to a conservative approach because of the advent of the neoadjuvant chemotherapy drugs. And main problem with the radical surgery of the breast wherein we do axillary lymph node or lymph node dissection is lymphedema of the arm, which is quite commonly we see when we do complete axillary lymph node dissection. So now what we do is just something called sentinel lymph node biopsy, which is one with a dye and also radioactive element. We inject in the primary tumor and identify the lymph node which is being taken up in the axilla. So with this, what we do is we identify and remove the lymph node which is actively taking up the dye, and we check it under the microscope during the surgery. Then if that lymph node is positive, we are going ahead and completing the axial lymph node dissection, or otherwise negative, then that patient will not require axial lymph node dissection. This way, so many patients are we are avoiding the complete axial lymph node clearance, so that we are avoiding the lymphedema. In patients who are requiring axial lymph node dissection, for example, the one or two central lymph nodes are positive, so to clear and to stage will do axillary lymph node dissection. In such patients, we are nowadays doing something called lymphovenous anastomosis during the surgery itself to prevent the occurrence of upper limb lymphedema. This is about the treatment options. And coming to the one other most important topic is chemotherapy. Most of these breast cancer patients will require chemotherapy. Do you have anything where we can avoid chemotherapy? This is the question posed by most of the patients to us. So now we have a test, a genetic test, something called can assist, where we analyze the risk of the recurrence of the cancer after the surgical surgery. So in such cases, if the recurrence score is high, then probably they will undergo chemotherapy. And if the risk is very low, we will be able to completely avoid chemotherapy safely in such patients, especially strong hormone positive like ER positive, PR positive, and HER2 negative. That is called luminal A cancer. In such cases, chemotherapy can be safely avoided. And even we are including the luminal B category, wherein there is a positivity of ER, PR, and HER2 positivity. In such cases where the low risk is there, we'll be able to avoid chemotherapy in such cases. And what about patients with advanced stage cancers, for example, stage 4 cancers, where there is no hope, or is it only palliative care, or there are curative treatment options? See, right now we have a lot of targeted therapy, HER2 positive, even HER3 positive must also being tested in trials. I just want to tell you one patient experience. It's a patient of CA breast cancer, which I operated around 4 years back. That time patient had a very early stage cancer, and she was requiring a chemotherapy. It was a HER2 positive and a stage 3 locally advanced cancer. Post surgery, somehow she was not convinced for chemotherapy. She was not ready to take chemotherapy. In spite of we convincing her, our team of medical oncologists tried to convince her to take chemotherapy. But the patient was not willing for chemotherapy, and she was well and fine for around 6 months, 1 year. I think 8th or 9th month, she came back with a recurrence. When we did a PET scan, the tumor was so bad, it was spread to all the parts of the body. She had even spine, bone mets, lung metastasis, and tumor was spread to the liver. Then we had a tumor board meeting, and our medical oncologist suggested we'll start with an anti-HER2 targeted therapy. And after 6 months of therapy, that disease was stable, not completely cured. Then we started a drug called TDM1, wherein we are combining anti-HER2 trastuzumab along with a chemotherapy drug. And she had 11 cycles of that drug after that, and 2 hours. And everyone surprised when we did a PET scan after 3 months of completing. There was no evidence of disease at all in her body. Complete disappearance of the disease was there. That was a case, you see, case which was very happy to our team and our whole team at us, like medical oncology, surgical oncology, were very, and we had presented that case also. So these there do chances of treatment in advanced cases also, when we can tailor the therapy, because she was positive for that, and we tailored the treatment and we could give her the best treatment available. And another scenario where we are helping nowadays is we take the liquid biopsy from the blood, is the blood sample from the tumor, is in stage 4 or stage 3 cancer patients, and we are sending it for a tumor culture. So as you know, we send, for example, our infection is there, we send for the urine culture, pus culture. What we do in that, we identify the bacteria or virus which is being grown in the media, and then we subject that bacteria to antibiotics. So whichever antibiotic is working on that bacteria, we give that antibiotic in human. So that has proven, been time tested from so many decades. So same being applied in tumors, where the tumor cells are taken from the peripheral blood, and the tumor cells are grown in the culture, and then we subject the tumor cells to different types of chemotherapy and targeted therapy agents, for all the cytotoxic chemotherapy agents, and we'll get a study result. Maybe, for example, known cancer anti-cancer treatment drugs of around say 20-25 drugs, and we subject the tumor cells to so many these cells, and whichever anti-tumor cytotoxic chemotherapy drug is being most active, those top 2 or 3 combination drugs are only targeted therapy can be given to the patient, and where we are in these cases we are expecting very good results. And see, yeah, these are all being in the clinical trial stage, but we are using these methodologies now in treating the patient. It's not about only breast cancer, even other solid cancers also. And especially last we had one patient with breast cancer. She was a triple negative. That means there is no area for target like PR negative and HER2 negative. And after the cancer test, where we got his test results of top 2-3 chemotherapies. With that, she's having a good progression-free survival. That is, tumor is being controlled over more than a period of 6 months. So, with this technological advancement being tailoring the treatment to the each patient, we're able to give a quality time to advanced patients, and for early cancer patients, good and equal survival with less of the side effects like lymphedema and surgical side effects like cosmetically equal results. So initially, when the surgery for breast cancer was radical breastectomy, it was cosmetically unappealing. So patients were not willing so many times were to remove of the breast. Now most of the patients are being eligible for breast conservative surgery. That means we are not removing complete breast. We will remove only the tumor or little bit of margin of the tumor around that. And also post that we have a very good reconstructive options, wherein oncoplastic surgery. That means we take surrounding adjacent breast tissue and remodify so that so that the breast volume is not lost and the contour is maintained. In patients wherein we require a larger amount of tissue is removed, we can do reconstruction with the various flaps like abdominal flap and pectoral flap and latissimus dorsi flap, and also we have implants like tissue expanders and silicone implants. So, surgically also evaluate a lot, wherein we are giving equal results with a better cosmetic outcome, and patients are being benefited with these because they're accepting the surgical options because we have a good cosmetic reconstruction options. So these are the few things wanted to tell you. And coming to the diagnostics, I told you about the PET scan and all. In Bangalore, we have something called a digital PET CT compared to analog PET CT. Results are better, and we are able to identify the distant diseases better in these things. And coming to other treatment options apart from chemotherapy, in some patients are where we are giving the breast conservative surgery or advanced tumors, patient will require radiation therapy treatment. In radiation therapy, quite long back, radiation therapy was radical, wherein there was no target. So we used to use the radiation to the whole of the chest or the whole of the breast. Now we have image guided radiation therapy and IMRT techniques. In these techniques, we give radiation only to the particular area of the breast where sterilization is required at axilla. So we are avoiding side effects. For example, if it's a left breast cancer, there was a lot of radiation exposure was to the heart, and they used to have a long-term side effects from the cardiac. So now we are avoiding those side effects from the radical radiation, and we are being conservative and give only radiation to the required area, that is the breast and the axilla. So this is about the radiation therapy, and the targeted therapy already discussed. So, and in especially hormone positive tumors like PR positive, so we are having drugs with less side effects with a minimal cost. So they will have a good survival with a period for more than 5 years, 10 years, 15 years. We are giving adjuvant therapy with the simple drugs for 10 to 15 years.
You want to look at this?
Yeah, I think I covered most of this. Basically, it's a treatment options like what are the options we have: surgery, chemotherapy, radiation, and targeted therapy. And as I was telling you about the CAN and certain, that is the test where we identify patients who are not requiring chemotherapy in early stage tumors.
This is the one you're talking about, no?
Yes.
If you can elaborate on this, it will be good for the people, sir.
This is basically people after surgery, basically early breast cancer, those who are in stage 1 and early stage 2 breast cancer patients. Side effects are related to chemotherapy. They are more worried whether to take chemotherapy or not. So we can identify certain subgroup of patients which we can avoid chemotherapy safely.
Okay.
Wherein we send the tissue sample for a multiple genomic analysis, and then we'll get a report saying this is a low risk or medium risk or high risk. In such cases, if there are data suggesting that without chemotherapy or with chemotherapy, survival is same. So maybe around 6 months of 8 months of chemotherapy and long-term chemotherapy, it can be safely avoided, especially hormonal positive, PR positive, and HER2 negative tumors. This is basically what can assist breast. So that inclusion criteria basically is a luminal A category, that is PR positive, and nowadays we're including even HER2 positive early breast cancer tumors. And there are most of them are lymph node negative tumors, or sometimes one single lymph node patients are also being included nowadays. In such patients, when the tumor sample, we send it for the histopathology and genetic analysis. So there is a AI generated report we get that says the patient is at very low risk for this tumor recurrence, and these patients we can safely avoid the chemotherapy. That's what the CAN assist basically means.
Okay, so initially when Dr. Shiva Kumar sir was been talking about the Bangalore, so we have a question here that is basically like, what is the unique advantage of receiving a breast cancer, particularly in the Bangalore, for the treatment?
Revati, as I told you, Bangalore is a center for us as a state and as a capital for Karnataka. And as per the treatment, we have all the available options. As I told you, we can do something called surgical evaluation or diagnostics options. We have great. And then coming to treatment, see, for I'll just example, I'll tell you. If there is a woman with a breast cancer or breast tumor suspected to be cancer, the biopsy is negative or the FNEC is not clear. In such cases, what we should do, what usually they do is they do and remove the tumor, then send it for histopathology. Once the report comes, if it is negative, then that will be enough. If by chance final histopathology comes positive, we proceed for a cancer surgery. But if it is the same thing we are doing in our hospital in Bangalore, what we have facilitated something called frozen section, where what we do, usually histopathology takes 4-5 days. In frozen section, during the surgery itself, we send the tumor samples to the pathologist. He will be in the operation theatre only. He will examine the tissue and will tell us whether the cancer is there or not. So we're able to take a call and avoid a second surgery in a patient if the tumor comes positive in the final histopathology. So like this is one thing about frozen section. And if a diagnostic digital PET CT is available, and the treatment option, therapeutic options like different amount of IMRT, IGRT, all these options are available in Bangalore. And we can give a comprehensive care to the patients, which includes all the broad specialty of the tumor treatment, that is the surgical oncology, medical oncology, radiation oncology. We also have a counseling sessions and psychology treatment support and the counseling system. We can treat as a patient whole when the patient is in Bangalore, where all of the facilities are available.
Thank you, doctor. And
Yeah.
adding up to this, see, it's not only about the Bangalore. So when we have an international patients connected to us, so how do the follow-up would be done? So when they are coming to the Bangalore, approaching us, so how would be the follow-up would be done through the international patients, sir?
Yeah, we see a lot of international patients flying in through Middle East, especially neighboring countries like Bangladesh, Sri Lanka, Pakistan also. And we have patients from other states like Bihar, Orissa, and West Bengal. So what will happen is initial treatment planning is done by us, and if require surgery or major surgical treatment is being done, and then if at all patient requiring further chemotherapy and all, some of the patients stay back for the completion of the treatment for 6 months or so, and some patients would like to go back to their old country for reason, where we write and give a devised treatment plan, and we coordinate with the oncologist in their country. For example, the patients some come from Africa and all. So we do and talk and discuss with the oncologist there, and we follow up or over the phone or video calls, and we'll have a continuous touch every before every chemotherapy session or every treatment change in the treatment. And if required, if further is a change in the drastic change in the treatment plan, they again come back for us.
Great, doctor. So it's basically you have a video call session available and you have a call session available. So whenever the patient's required, so you contact them directly and you interact with the doctor who's there in international, right? So abroad, basically. Okay,
Yes.
great, doctor. And adding up, there's one more question. So we have participant who's asking for few success stories about your breast cancer which you have been done, sir. So can you please share us a success story, please?
Yeah, see, one thing, breast cancer is we are in, as I told you, Bangalore, we are detecting most of the early cancers. Like patients come in a very early stage, especially in the urban population. So most of our patients are being very happy and they're disease free over 10 years period. And we do get patients from the rural areas, like distant areas in like Hubli, Dharwad, Raichur, and all this. So where we find tumors to be very advanced. And such one thing was an 18-year-old young lady who had presented to us. She had a tumor which was quite advanced. She was like she was not she didn't go to a doctor because of some other issues, and she didn't. When he visited us, tumor was stage 4, but the only good thing was the tumor was limited to only one of the bones in the back. It was not spread was not there to like liver, lung, and all. So initially we did examine, and after that, after initial diagnostic workup, we did a complete PET scan, then a genetic workup, and tailored therapy we started for with chemotherapy initially. After 6 cycles of chemotherapy, there was a significant reduction. Like a tumor had almost come down to around 1 centimeter from 7 centimeter, and other side there was no spread in the other side, and the bone disease was also completely disappeared after the chemotherapy. So then we had a discussion, because it's a single metastatic disease, and the primaries responded well, and the disease also disappeared in the bone. We subjected her for the surgery. Post surgery also, she took chemotherapy for 6 months. This is like 4 years, 5 years back. Until now, the patient is disease free, and she's married and she's having a child. That is one thing which gives us happiness when she comes every year for the follow up, tells her that she's being very happy with the treatment, and she's able to lead a normal family life after the treatment of surgery, chemotherapy, everything. This is one of the stories. Other thing I was telling, one lady who had undergone a surgery, and then she was reluctant to take chemotherapy, and then within 6 months she got the disease everywhere in the body, and we did started her on TDM. That's a drug which is active in HER2 positive tumors, And after the drug, maybe 11 months into the treatment, she completely recovered, and so much of extensive disease completely disappeared. And that is another story. There are so many patients who are being treated. No, these are the things where I remember which people come and tell us that we had lost hope and given us a good life.
Thank you, doctor. That was really a great successful story of yours. So nice to hear about that. And we have one question from Lata. So who's been asking us? See, as you had said, is there are patients who get a cancer in the age of 18, maybe 35 or 40, depending on their history as well. So here the question is like, so patient would be in a different aspects, like maybe as per the food habits or family history or any physical fitness of them or such. Okay, so is this treatment going to be a personalized treatment for each patient, or it will be a common for the particular general patients?
No, is that's what I was telling. So treatments are tailored to each patient. It is not like a stage one treatment. This is the this. It's not like mathematics. We give same treatment for all. So, for example, I'll tell you, if an 80-year-old patient with a early tumor and a very hormone positive tumor, so we are observing them without chemotherapy. Such patients, because their old age and they're very well differentiated cancers, hormone positive, and the tumor is not very aggressive, especially if the same thing is an young patient like 18-year 19-year-old. We are being more aggressive in the treatment because tumors which are seen in the young patients are we seen they're more aggressive, the chance of recurrence are more. And also so many things come to factor when we are treating a patient, whether the patient is from a rural background and whether they will be on a regular follow-up. If it's a patient is a active young female, we'll offer her a breast conservative surgery wherein we're not completely removing the tumor. The same patient, older woman from a rural background, it is difficult for her to come for a regular follow-up, or it is financially or logistically, then such patients, if at all we think it, she might not turn up for our regular checkups and the treatment option, we may offer a radical mastectomy options. So treatment is being treated not only about this logistic, economically, socio-economic, also genetic factors. More every patient is being tested for the genetic state and whether what is the risk of recurrence. Based on that, treatment is tailored, especially surgical or chemotherapy or hormonal therapy.
Thank you, doctor. So these were the questions from our participants what we had currently. So any other tips you would like to give us, doctor?
Yeah, wow. One thing important I would like to tell is screening, which is very important because we are seeing uh, patients detected at early stage, like stage 1 or stage 2. Most of them are being cured, at least to 95% survival at the end of 5 years. Compared to a stage 4 disease, stage 3 disease, we have around 30 to 40% survival at the end of 5 years. So every woman at least beyond the age of 45 years, yearly once in a year mammography will definitely save their life. Because we'll not only identify early cancers, some of the things which are before the cancer even started, like something called DCIS, that is a in situ cancer. That is detected on the mammography. In such case, only surgery and observation will be enough. So that is one thing. And regarding the other cancer, like a cervical cancer, we do have a vaccine that is like it will prevent around 3 to 4 cancers. That is very beneficial if they're given at least at the age of 10 to 12 years. And as for the screening, if there is a family history, patients has a family history of cancer, or some patients have a genetic history, some are undergoing a genetic screening also. We do whole genome NGS whole genome analysis. If the particular patient is at risk, then we offer treatment options like removal of the ovaries and removal of the breast also based on the genetic risk. This one thing I would like to tell is screening is very important, and awareness about the breast cancer and oral cancer, and also self breast examination also very important thing. At least once in a month, examine self examination of the breast, that will be able to identify any lumps or tumors, and consulting an appropriate oncologist will definitely help patients detecting early.
Thank you, doctor. That was really a great tip. So hope every woman who's been watching or not watching this post video also do this exercise every month so that would help their life to save them?
So this webinar now it's live on various platforms. It's live on through Facebook. It's also been sent out through various groups, targeted groups on cancer in Bangalore. All those groups. We are having not only the participants here, there are also viewers in through the other networks who are not able to post questions. For all those viewers who are not able to post questions because they're not joined using the link and just watching on Facebook and other platforms, Revati, if you could share our numbers with them or the email address which they can get in touch. A lot of them, because cancer being something which is, there is, especially breast cancer, many women, they don't come out in a public forum like this. So if you could share the phone numbers and the email addresses, it will be great. So some of them could as well get in touch with you directly.